To one and all present here. First of all, I warm welcome to the dignitaries of on the dais and off the dais. I am Dr. Manigandan, Assistant Professor of Economics, Erode Arts and Science College, and also the organizing secretary of this webinar. First of all, I would like to thank everyone who gave me this opportunity on the online webinar program. This is the fourth program of COVID-19 webinar series. All programs organized and arranged by our head of the Department of Economics, Dr. Mani sir. So now I would like to welcome Dr. N. Mani sir, HOD of Economics, to welcome the gathering. Thank you, sir.
Thank you, Dr. Manigandan. Good afternoon, one and all present here in this webinar. Actually, though we are conducting, this is the fourth webinar. Majority of the other webinars, all the three webinars are participated by our indigenous people. That means indigenous means in Tamil Nadu only. This time there are participants from all India level up to Assam. And also this is the first time that we are going to organize this kind of webinar or in this particular type. How this social relationship, social behavior, customs have been changed, and how these inequalities are increased in the period of COVID pandemic. Such kind of a topic was not being discussed not only by us, but many of the public forums, those who have organized webinars and those who are discussed these type of issues, they were not also touched upon in this. Either whether they belongs to health or people like us, those who are associated with economics and management, all the people are not touched upon this particular title. When we fix this particular title and we search a resource person, suitable resource person for this workshop, first of all, Dr. SIGAMANI P came to my mind, but I am not being touch with him over a period of time. Dr. Shivashankar, who is served as Assistant Professor of Muttaram Government Arts College in Vellore, today is joined as Associate Professor of Economics in Central University of Pondicherry today. He has introduced Dr. SIGAMANI P for us, and as soon as we invited, he has so voluntarily accepted, and he is very keen, and he has changed the title, and he has increased the input for our seminar, and yes, being with us. Such kind of a wonderful seminar is going to take place very shortly for such kind of a novel topic. So far, no people has touched upon and put it in the public domain. Such kind of a topic is going to be discussed here for this type of seminar. Webinar, our former principal and director of our college is being with us, and he is going to preside over the function and facilitate the function. I wholeheartedly welcome Dr. Venkatachalam, former principal, our faculty member, and currently director. He is guiding us, and I welcome on behalf of this gathering and on behalf of the department. And then our chief guest, Dr. SIGAMANI P sir. We are fortunate to have an interaction and introduction with him by this time. Dr. SIGAMANI P is professor and head in the Department of Social Work, Central University of Tamil Nadu, Thiruvarur. and he has awarded his PhD in Jawaharlal Nehru University and postdoctoral degree in USA, and now he has his PDF and he has a FRSA in UK and FRSPH in United Kingdom, and he has also Raman Fellow, such kind of a dignitary. Now he is serving as a professor and head, and he is coordinating the Center for Happiness. It is associated with the Department of Applied Psychology in the Central University of Thiruvarur, Tamil Nadu, Thiruvarur, and he is a visiting research professor in the University of Minnesota, USA, and he is a professor. He is a visiting professor in University of Jizhuwa, China, and guest professor of Tianjin University, China, and he has authored a good number of articles published by national and international reputed. Very particularly, these journals are being published by Belgrave Macmillan Publishers, Springer Publishers, and Sage Publications, Wiley Publications, Bloomsbury Publications, and EPW Cambridge Scholars Publications. These kind of publications, one who is closely associated with academic activities, they could able to understand the nature and the weightage of the articles being published in these journals. Apart from these publications, he has published 16 academic reference books for academic references. And I already mentioned that he is a fellow in Royal Society for Arts and Manufacturing and Commerce in the University of Minnesota, USA, and fellow of Royal Society for Public Health in UK. And he has conducted research projects for ICSSR and Indian Council of Medical Research and very many other universities also. So such kind of a noble person in the young age. He is not so senior in the age. He is a senior. He is meritorious in his academic performance. He is so young. Such kind of achiever is today with us, being with us to deliver a lecture on this occasion. I wholeheartedly welcome Dr. SIGAMANI P for Erode Arts and Science College, and I welcome on behalf of this gathering. Next, I wish to welcome, there are so many research scholars, academicians, various university professors, and college professors, and certain people, those who are guiding or associating, or they are also organizing so many programs on behalf of their umbrella, like Dr. Kumar. He is a secretary of Association of Economists of Tamil Nadu. He is being with us. He is a professor of economics in Jamal Muhammad College, Trichy. And people from other universities also with us. I wholeheartedly invite all the dignitaries, those who are joined with this evening, to listen Dr. SIGAMANI P's noble lecture. Like that, other people, those who are with us from our department, senior professor Dr. C.A. Parisa, and other faculty members in our department. Each and every faculty member has coordinated one webinar so far relating to this pandemic situation, and they are going to organize next cycle of programs also. They are ready for organizing programs for the next cycle. so that I invite all the faculty members of our department wholeheartedly. And I invite the people, those who are joined with us from our aided stream and self-financing stream, and the people, our students, they are also continuously joining with us. They are engaging with us. Such kind of our teaching and non-teaching, self-financing staff members and aided faculty members and our students, I wholeheartedly welcome all of them for this unique webinar organized by Dr. Manikandan. I thank Dr. Manikandan for his meticulous planning and efforts to make this make success of this. With these few words, I conclude my welcome address. Thank you, Nanda.
Thank you, sir. And now I welcome to our humble and honorable my director, sir. He is my mentor, Dr. Venkatachalam, sir, to deliver the felicitation address. Thank you, sir.
Thank you, Dr. Manikandan. Respected Secretary and Correspondent of our esteemed institution, Savani Chamalaya. Respected Principal, sir, Dr. R. Sankara Subramaniam. Beloved HOD of my department, Dr. N. Mani, sir. Coordinator and Organizing Secretary of this program, Dr. Manikandan. Respected Chief Guest of this program, Dr. SIGAMANI P, Professor and Head, Department of Social Science, Central University of Tamil Nadu. My intimate friend, Dr. D. Kumar, Associate Professor, the Department of Economics, Jamal Muhammad College, and Secretary of Association of Economists of Tamil Nadu. And my dear participants, teachers from various colleges, teachers from aided and self-finance stream of our college, and teachers from CANI Consortium led by Nadu College, Coimbatore, and my dear participants. Good evening to one and all. The PG and Research Department of Economics of Erode Arts and Science College is very busy in organizing series of programs related to Covid-19 issue. Today's topic is very much related to socio-economic problem, and the department has invited an eminent professor, Dr. SIGAMANI P, to address on inequalities and social relationship in the age of COVID-19 pandemic and beyond. Needless to say that inequality is inbuilt in our economy, and it is increasing even with economic growth over the years. Now the problem is status of inequality in the age of COVID-19 and even after pandemic. The post-pandemic world could experience even greater inequalities unless the government to do something. There should be some comprehensive program to reduce income inequalities. More jobs are to be created throughout the nation. Otherwise, the situation will be worsened further. With these few words, I would like to conclude my speech, and I thank the Chief Guest, Dr. SIGAMANI P, for being with us to share his ideas. Also, I express my sincere thanks to Dr. N. Mani, HOD, and all the faculties for having organized this wonderful program. Thank you.
Thank you, sir. Now I invite our today's valuable and respectable Chief Guest, Dr. SIGAMANI P, Professor and Head, Department of Social Work, Central University of Tamil Nadu, for delivering Chief Guest address. Thank you, sir.
Thank you, Dr. Manikandan. Good evening to all of you. Most respected Dr. R. Sankara Subramanian, Principal, Erode Arts and Science College, affiliated to Bharatiyar University, Coimbatore. Our respected friend Dr. N. Mani, Associate Professor, Aid Department of Economics. Dr. Manikandan, Organizing Secretary. Dr. Venkatachalam, Director, IQSC. Colleagues, friends, students. Good evening to all of you. It gives me an immense pleasure to be part of this webinar. And let me take the wonderful opportunity to thank Dr. Mani for giving me the opportunity to be part of the webinar series. So today's discussion, as our Dr. Venkatachalam sir has introduced the theme with its impacts and consequences on economy and society. So for another 40 minutes, we shall be discussing the anatomy of inequalities and social relationship before, during, and after pandemic season. It's timely session as Dr. Mani, head of Department of Economics, he was sharing that experience on many occasions. Everybody is talking about the implications on so many other aspects, on the biomedical perspectives, behavioral sciences perspectives, social sciences perspectives. There were very limited focus on inequalities. So, but recent trends like World Bank, IMF, Asian Development Bank, they had initiated several discussions, debates, roundtables discussions on this topic. So this is a review I have initiated some time back. I would like to dedicate this work to helping professionals and victims of COVID-19. The presentation structure today, I'm going to present three aspects of the topic: growing inequalities and social relationships during COVID-19 and beyond. So the lecture has been divided into three sections. Section 1 would be looking at the introductory part and research methods. I would like to present it here as a systematic review. We have done a lot of data synthesis. So each and every argument of my presentation would be based on the available data across the globe. Therefore, the section 1 of my talk would be briefing about 4 major aspects: the take-home lesson, scope of this today's lecture, introduction and data sources, background and objectives, and sociology of pandemics. So the sociology of pandemics, I'm going to look at it 100 years back as well. Several pandemics and its impacts on growing inequalities in our society, not just only in Indian context, as even the global context. That is section 1 now. Section 2 of my talk includes the situational analysis of the actual pandemic condition across the globe. I have divided this section into broadly 2 aspects, like industrialized economies, that's the high income countries, and the low and middle income countries. There we are again going to look at in 5 dimensions: pandemics and society, the social consequences of COVID-19, the social construction of COVID-19, social consequences of containment measures like the great lockdown and its impacts on humans, especially on growing inequalities. And the last part of the second section includes the impact of COVID-19 and growing inequalities, where we are going to look at the country experiences as well as in Indian context, different states' experiences on this particular aspect. The third part, last part of my talk, includes the challenges and way forward, which will have again 5 sub-components. It's all about social network, the relevance of social relationships and social networking, culture during the critical period, then beyond COVID-19, and social development. So after understanding the causes and consequences of this particular pandemic on human relationships in the society, so what can be done at the next level in terms of interventions, in terms of research, in terms of policy, followed by future research, policy relevance, and then conclusion. So this is a broader structure of my talk. So throughout my presentations, I'm going to refer these 10 keywords, which includes, these are all critical: COVID-19 pandemic, social construction, social networking, informal economy, health inequality, gender gap, political economy, global health diplomacy, low income countries, and data synthesis. To be precise, the topic on the impacts, it's necessary to understand the political economy as well as the global health diplomacy in the context. So the first section, it's all about the anatomy of COVID-19 and its impact on the society. So broadly, the COVID-19 deepened inequalities, wealth, education, gender, etc. across the globe, not just only in one country, not only in developed countries, even in developing countries. So there was a very interesting quote by Lucas, but he said, the COVID crisis has expanded the inequalities between very wealthy and the rest of the population. Yet in rich countries, Those governments interventions prevented massive rise in poverty. But this was not in the case in poor countries like low and middle income countries. So this shows the importance of social states in the fight against poverty. So the inequality reflected on several aspects, including the growing number of unemployment, poverty, and so on. But somehow the developed countries could manage it, but emerging economies could not manage. That's what we're going to look at the various parameters. The take-home lesson, the expected outcome of today's lecture, there will be 10 points. At the end of the talk, participants will understand and realize these aspects. To understand the dynamics and interconnectivity of contemporary society. So broadly, I'm going to look at it. Society, economy, and development. It's like factors associated with social development or social indicators. To examine COVID-19 pandemic impact on inequality and social stratification. Many of you must be thinking, the stratification, the divisions, it's not new for countries like India, even the other developed countries. But the COVID-19 aggravated the situation. To understand the entire process of the great lockdown, social distancing, quarantine, creation of containment zone. Of course, all these things were part of the first and second waves of COVID-19, but the impact, it will be long lasting, at least till 2024, that was predicted by the World Bank, IMF, and Asian Development Bank. Then the fourth take-home lesson of today's lecture, we need to understand there is something beyond biomedicine. That's a biomedicine and relevance of social and behavioral sciences. At the end of the second wave, across the globe, everybody realized that the importance of community participation in prevention and control of COVID-19. Similarly, the community participation in other infectious diseases. That's what we need to understand. Social construction of diseases and illnesses. Science sense versus common sense. At the end of my talk, I'm sure you shall realize the importance of the difference between the science sense and common sense. People are just playing with the virus. People in the responsible position, they can't make a certain statement or certain directions to the followers without any base of science. Therefore, when it comes to the growing inequalities and the social networking, science sense plays a major role. Strategies for tackling the growing inequalities. So at the end of the day, we shall be analyzing countries' experience on those inequalities and then the responses. Social networking, rebuilding healthy and sustainable society. Multi-stakeholders participation in social development. It's not like one person can play a role. Everybody has to play a role at the individual level, family level, community level, state level, international and the global level. Then only we can tackle the growing inequalities at various levels. To understand the relevance of building a public trust and social relationships. Without the public trust, it would be difficult to handle certain situations. Therefore, the first thing first, what we need to understand at this juncture across the globe, some countries are facing fifth wave, few countries are facing fourth wave. India, we are at the third wave. What is most important here? We need to look at the situation. First of all, we need to understand that there is a problem, and then we need to work out the strategies. So therefore, save lives, protect livelihoods, policy directions, decisions based on evidences. That is most important for the policies and planning. Now, the genesis of COVID-19. I'm sure most of you would be aware about the genesis of this COVID-19. Like it was started at the end of 2019. The serious pneumonia caused an unknown cause of emerged in Wuhan city in China. In first week of January, so WHO like named it as a it's a kind of pandemic. Not exactly they have given the clear-cut directions to those states, but they have said it's a pandemic. And then 11th February they realized that the seriousness of this particular virus. Then they named this as caused by SARS-CoV-2 as COVID-19. Even they were named as coronavirus disease 19. That is an abbreviation for COVID-19. And March 11th, it started spreading across, and the number of countries involved was 114. Within the cases increased from few numbers to thousands and then lakhs. including the deaths. And then the WHO declared this as the pandemic status. So there is a need to understand the genesis of this particular virus. Therefore, that we can really bring that kind of critical analysis of this particular as growing inequalities in the society. And today's situation, it's about 367 million people have been affected, infected with this particular virus. And similarly, about more than 56 million people died due to this virus. Hello?
Yes, sir. Yes, sir. Audible, sir.
Yeah. So the routes of transmission of these most affected countries, there are two major points we need to understand. Number one, so many countries across the world, let me refer Indian context, even before COVID-19, there were several inequalities. Inequalities was based on gender, region, and so on. But this particular virus has aggravated the whole situation. But here, the starting point, so across the globe, even the Chinese government, other governments immensely failed to carry out the WHO declaration on global health diplomacy. As part of the global health diplomacy, if something happens with one country on any kind of disease or virus, so immediately they will have to take precautions. Strict travel restrictions. Number two, entry and exit options. Number four, coming out with scientific database to understand the causes and consequences of this particular virus, so that we can prevent further spread of this particular virus. We have been good enough to manage the SARS-1 and even Ebola virus that point of time, but somehow this COVID-19 could not do that. Therefore, it had a major impact on every aspect. The COVID-19 pandemic and the associated economic and social crises are posing huge challenges on human beings. Availability of best accurate information or free and affordable COVID-19 testing and treatment protocols. Now the problem is like affordability of these vaccines. Emerging issues related to jobs, incomes of millions of people, social safety net, income support schemes, burden on women, migrant workers, and informal sector workers. At large, the global solidarity and coordination was needed at these conditions. Now, India's large informal sector workforce was the first hit, as it made up 75% of the 222 million jobs lost, the big divide. In fact, the World Bank predicted that across the globe, about 150 million people will be losing the job. They may become a chronic like poverty line. As well as the closure of business operations, starting with the small scale industries, medium scale industries, large scale industries, there are major impacts on employment. So one of the serious challenges that the world faced at the recent times, the total cost is yet to unfold. Then only we can come to know exactly the loss due to this particular virus. Restrictions on economic activities is still continuing, including number of no production, firms unable to sell their goods and services. So high economic and social costs around the world, social distancing, lockdown, quarantine, and change in the production and consumption pattern, market crashes, closure of business operations, and so on. So the recently published World Inequality Report 2022, this is located in France, and in this report, they have projected these aspects. The global impact of COVID-19 crisis on inequality includes the COVID-19 and the economic crisis that followed hit all the world across, but it hit them with varying intensity, where the divide is increased within and within the country and between the countries. Europe, Latin America, and Southeast Asia recorded the largest drops in national income. In fact, we had negative growth between -6% and the to 7.6%, while the East Asia, where the pandemic began, succeeded in stabilizing in 2020 income at the level of 2019. In its reference to India's specific findings in this report, India stands how as a poor and very unequal country, the top 1% of the total population hold the more than 1/5 of the total national income in 2021. That means there's a huge gap between group, that 1% of the population to the 99% of the population. The economic reforms and liberalization adopted by the government mostly benefited those 1% of the total population. That means what? That means the inequality has widened. Sending millions of workforce back home due to the lockdown. So several states, almost every state, they have closed their borders. That means it will have a lot of implications. Travel restrictions, like more than 150 million people could fall into extreme poverty in the absence of active policies to protect the substitute income flows. That was the data by the World Bank. This will severely impact the health and well-being of large parts of the population till 2024 and beyond. That impact. So therefore, based on these information collected, published data from UNDP, World Bank, IMF, and other sources, including the World Inequality Report, to understand the implications on the growing inequalities. 2020, 21, 22, this 2 years period, it is not only about the COVID-19, we had several other natural disasters, as well as the existing problems, in terms of communicable diseases, non-communicable diseases. So there was a dual burden on their health. So we were talking about the marginalized groups and so on. That kind of argument, I'll come to that later. But the growing situation, it's contributed a lot to the prevailing situation. So it brought the unequal impacts, as well as it brought several other implications on human health. So the background, based on the above mentioned data sets, I have developed 4 sets of background for the argument. COVID-19 challenge for all public systems across the globe. Far-reaching consequences beyond the spread of COVID-19. You can't think at one level, it reached to the several levels. National and international context with the medical sociological point of view, there we have realized that the importance of social determinants of health at this context. COVID-19 added to the existing problems, including communicable diseases, non-communicable diseases, inequality, gender issues, unemployment, starvation, below poverty line, in fact, chronic poverty line. As I said in the beginning, like 150 million people may fall into chronic poverty. So based on this background, I have developed 4 major objectives to understand this particular subject matter, to understand the social construction of health, to explore social consequences of COVID-19, to study the emergency disease control measures, preparedness, and impacts on society, where we are going to understand the relevance of affordability as well as accessibility. It is not just about only providing or creating the system in place. It's also about making people to understand to access those facilities and to understand the role of multi-stakeholders in the context. Now, the sociology of pandemics, the available literatures has several dimensions on this. I would like to bring those 3 observations. Number 1, the social construction of illness is a socially constructed man-made artificial phenomenon across the globe, whether it's Europe or North America or UK or India or any other country. This is commonly established. So constructions through cultural or social practices, pre-existing social and economic inequalities. For example, in UK, it's about economic divisions. In US, it's about color, it's about racism. In India, it's about caste system. So, but the outcome would be the same. Outcome would be the same on whether it's a racism or economic inequalities or caste-based inequalities. Now, the look at the definition of society itself. According to Erlamer's book, they have cited a definition on society. So, 2 things we need to understand. Look at the term meaning of society, and then the COVID-19. The society itself, like the large group of people who live together in an organized way, making decisions about how to do things and sharing the work that needs to be done. But here, there's another interesting fact is that in India, most of the people are living in a single room. So we have seen in the first and second wave. So if one person is infected in the house, means automatically the others will be infected. Therefore, it's necessary to understand the relevance of social and behavioral sciences to support the COVID-19 pandemic responses. Government without such kind of approaches, certainly they will not able to uh, get
Hello?
good results. Hello? Hello? Mani sir?
Audible, sir.
Okay. Therefore, understanding the behavior and social sciences context. And look at this one. It was published with another source. The impacts of pandemics on inequality. Inequality was there already, actually, across the globe. But this particular aspect aggravated the situation. Then social and economic impact. That argument will come to that later. So recently we published a review paper with one MDPA journal on the great lockdown in the wake of COVID-19 and its implications, lessons for low and middle income countries. Our thrust and arguments was based on improving the situations by providing alternative livelihood opportunities and then providing them with direct support system. So therefore, the COVID-19 increased inequalities in many areas. This again, it was published by BMJ. So they cited 4 major impacts: vaccine availability, economic growth, access to education and healthcare, the scale of job and income losses. So to sum up the first part of my presentation, there were 11 aspects has been emerged. Number 1, long-standing inequalities. It was there already, but the COVID has aggravated. It was growing wider and wider. Significant increase in poverty. So, as predicted by the World Bank, it's going to be more and more, much more complex problem in the system. Not only in India, across the globe. The global income inequality within and in between nations. Low income people, youth, women, and informal sector workers are faced particularly severe job loss and income loss. Without a forceful public policy response, it would be difficult to achieve any kind of equity situation. Disparity, like gender-based disparities there. Support from the global community is essential to expedite to an inclusive and sustainable recovery. Based on those data, it's necessary to understand the multi-stakeholders participations, bringing the bilateral and multilateral organizations to deal with the current crisis without any conditions. And the previous period, before COVID-19, we do have certain support from those bilateral and multilateral organizations, but they had condition-based funding. But at this juncture, we need more funding without any conditions. Reactivate the economy, workable strategies to reduce the gap, access to resources, promote humanitarian assistance and social protection. Therefore, the first part, with that background, so we have realized that the importance of state response to deal with the current crisis. Section 2, about the situational analysis of this crisis and the growing inequalities, can understand through 5 major subsections. Pandemics and society, that's what the social networking, the social consequences, social construction, the consequences of containment measures and impacts on human society, then the impact on the growing inequalities. Pandemics and society. The infectious diseases are part of the human social system. The Nature Journal published a paper on the pandemic's history. So every 100 years, there will be one pandemic, and then they have analyzed the causes and consequences. So it's common. The concept of diseases is always a social and historical product of culture, and stigma is always associated with this. Gender caused disruption of daily routines, worldwide effect of the pandemic. The pandemic since 20th century, the deadliest hit, like Ebola, HIV, Spanish flu, SARS-1 and 2. But the SARS-2 has had a major impact on the human society. The origin and prevention of pandemics, that's an argument there, like the human-animal interface to the disease emergence process. The future prevention strategies, which include social mobilization, social networking, social relationships, public health education, behavioral changes, and communication strategies are needed at this juncture. As I said, in the Nature Journal, they published several papers based on pandemics, its impact on human society across the publicly many several papers, their centralized argument is that the relevance of behavioral and social sciences in order to understand the inequality. The absence of pharmaceutical interventions like a public health surveillance and epidemiological data, again, it will add more problem to the current crisis. The global health problems, another paper by Fiedler before like 10 years back, 12 years back. In this, their major argument is that we need to look at these pandemics beyond biomedical perspectives. We need to look at these pandemics on social construct. We need to look at these pandemics on determinants of health perspectives. Then only we can reduce such kind of crisis. The critical public health epidemics and inequalities from 2001 and 2020, like from anthrax, SARS, H1N1, then wildlife flu, Ebola virus, Zika virus, coronavirus. So across these publications, whether it's a BMJ or Lancet publications or New England Journal of Medicine's publications, every journal, their centralized focus is that to understand the perspective, to understand the impacts of these pandemics on human health by realizing the relationships, like globalizing risks and bringing on the local level interventions. The emerging trends, risk factors associated with COVID-19 includes, like a sharing of the data, government trade and access to medicine, child health, maternal and newborn health, management of communicable diseases, mass casualty management, nutrition, sexual and reproductive health, trauma care, water, sanitation, hygiene. So these are all the important aspects. But here, when we look at the inequality, it is all available for everyone, but actually it was accessed by one set of populations thoroughly. The other set of population they could not access. Therefore, in our recent publications on the second wave of COVID-19 and beyond, it was published in EPW. And also there was a discussion on COVID-19 and global income inequality there. That's also bringing that equitable society by providing affordabilities as well as accessibility to the available facilities. The social consequences of COVID-19 includes health inequality, which is part of the social stratification, low income individuals, lack of access to essential healthcare services, educational impact, gender issues, domestic violence, individual isolation, psychological impact, economic impact. I'm going to discuss these subheadings in details. Political impact, environmental issues, person with special needs, including elderly issues, religious impact. So all these 11 points, what was the central theme? The central theme was that the inequalities has been multifolded. So for instance, the health inequality. So the poorer are dying from COVID-19 and other diseases, like a due burden on their health. Current situations across the globe is getting worse, especially the low and middle income countries. The result of the COVID-19 pandemic will likely only make the health inequities worse. So these are all based on the available data. COVID-19 put societies to the test. Inequality could spread the COVID-19, the social inequalities and health outcomes. Increased inequality from COVID-19 will have long-term consequences, at least till 2024 and 25. So the relevant measures, it's like a policy response to the prevailing health inequality, like need for strategic planning during and after the pandemic, existing socio-economic and health inequalities. First of all, we need to accept that there is a problem, but many countries, that's what is not happening. Accepting the problem and understanding the current crisis and bringing the multiple opportunities and options, like setting the priorities, generating database, awareness creations, making use of the available facilities, and then so on. The economic impact. Economic impacts also widen the growing inequalities. How does the COVID-19 impact education? Answer is like this: relevance of classroom teaching, midday meal schemes options in Indian context, medium and long-term impact. How can education mitigate COVID-19, its impact? Immediate impacts on educational institutions. Some impacts are not immediately visible and unfortunately very significant, like the closure of those schools and colleges and universities. Closure of schools, colleges and universities have major impacts later. and then placement. May I request the participants to please mute your audio? Placement and job opportunities, higher studies options, mental health impacts, and so on. The suggestions to ensure right to education for all, non-discriminatory efforts. So here it's again it's about state response to provide such kind of facilities from one level to the next level. Again, investment in higher educations during this period. Gender issues, increase in gender-based violence during this pandemic period. Work burden, large impacts on working women, gender-based violence, economic uncertainty, job loss, stress, domestic violence, family as a primary site for the abuse. So the evidences say child abuse, neglect, and exploitation, protecting sexual and reproductive health rights, and promoting gender equity. And violence against women, violence against children, violence against elder has increased during this period. Domestic violence, increased risk of family violence during the COVID-19 pandemic. Domestic violence became more prevalent. Lack of access to healthcare services. These are all very common even across the sections, not just only one group, the multiple levels. So individual isolation, emotions and risk perception, disaster and pandemic, fake news and misinformation, the consequences of isolating the elderly, risks of cardiovascular diseases, autoimmune diseases, neurocognitive and mental health problems, aligning individuals to collective interest, social isolation and loneliness, increased stigma and discrimination. Therefore, this actually aggravated the situation. So we have seen several images during the first and second wave, with all these impacts, mental health and psychological impact. So COVID-19 pandemic had made mental health conditions worse across age groups, especially among children, women, and elders. People were unable to access mental health support during the period, even now as well. Lack of face-to-face support, the stress and anxiety. The mental health issues are not only for those who lost jobs, but also for those were about to enter the labor market for the first time. It's critical. Last 2 years, we know the campus placement situation, job opportunities for our youngsters. There was a problem. Impacts of coronavirus outbreak on psychological, it actually impacted individuals, families, communities, societies, and nations. Economic impact due to the lockdown, the economic activity is affected in many ways: production, distribution, and consumption side. Restrictions on trade and business, large-scale uncertainties, lack of access to resources. Okay, here that 1% population by the inequality report, they could survive. Their income has been multifoldly increased, but people belongs to lower or marginalized sections, their income has been drastically reduced. That's what the available data says. So the pandemic is not only exacerbated by the deprivation and vulnerabilities of those who are left behind by rising inequality, but its fallout is pushing inequality higher and higher. So the worst economic performance in 4 decades. This was predicted by UNDP. The sudden disappearance of most informal nature of employment or sector during this period. So this will take at least 2 to 3 years to recover. But conditions that the state should take and active measures to intervene in this particular. The greater risk to the most vulnerable, BPL, elders, women, children, persons with special needs. The economic outcome of the regions is, as we have witnessed, that there is a negative growth. That means what? That means poverty, unemployment, inequality, and then unrest is there. But there's many states, starting with China, Brazil, and other countries, other parts of the world, that including India, have taken measures to rectify the situations. But whatever has done so far, that is not enough in our context. So we'll have to take proactive measures to bring back the system in place. Political impact also there. So implementation of wide range of lockdown, provision of social assistance like workers, women, etc. Extraordinary power and political will is needed. Plan for the post-COVID-19 crisis and strategic leadership. Environmental issues, again this has aggravated the situation. Like before COVID-19, increasing environmental problems and social issues, But those problems are there already, like climate change, disasters like flood, cyclone, those things were there in addition to COVID-19. So it actually added to the existing crisis. So rethink and redefine sustainable development goals by UN. It's what needed at this juncture. Conservation funding, human interventions to survive, food and water supply, including housing facilities, rethink SDGs strategies, and then persons with special needs, including elders, which means the one group faces additional risk and consequences. They are not normal, like as well as the anxieties, people with disabilities or chronic illnesses. So they don't have the facilities. During the second wave and first wave, the entire system has been shifted to the COVID cases. So there were absolutely no facilities available for people with other complaints. Therefore, the person with special needs can completely denied of such kind of additional facilities. So disproportionately impacted due to attitudinal, environmental, and institutional barriers. Pre-existing health conditions that makes them more susceptible to the virus infection. So we still don't have the exact data in terms of gender, in terms of economic categories, in terms of normal or special needs, and so on. And women with disabilities faced even more problem. Even elders with disabilities have faced additional problems. So religious impact, like cancellation of workshops, so worship places, cancellation of pilgrimages, cancellation of celebrations, festivals. This was all happened during the second and first waves. But unfortunately, the interfaith response to COVID-19 was limited. They could not focus much more on the support system, the social construction of COVID-19. Like the COVID-19 is a continuing story with the global impact, sudden and rapid outbreak affecting many lives within the community regions in one time. It affected exceptionally large proportion of the population in the country and then several nations. Which means here, social and economic dimensions can play a major role in terms of prevention and control. The social consequences of the containment measures includes, poor or lacking the access to essential healthcare services, not only for the COVID-19, even other. So less access to authentic information, isolations, like people have been isolated. Now here, the connection between infected persons to the other infected persons, the connections between one state to the other state, the connections between federal government system to the state governments, it is what actually somehow strategically what not exactly linked with the interventions. Example of stimulated process that starts with the person say being infected. It's like both merger of both the biomedical perspectives, social perspectives, and then developmental perspectives. So what we can do, like the impact can be understood by way of bringing those 14 dimensions. So first of all, we need to recognize the cognitive biases, avoid partial solutions during this pandemic. Learning is critical. So therefore, we must learn lessons from the best practices. Extensive testing as well as the vaccine facilities, proactive tracing of hospital cases, that was especially during the two waves. But right now it's about to vaccinate people. A strong emphasis on home diagnosis and care. Now there's a need to have a strong emphasis on promoting alternative livelihood opportunities. Specific efforts to monitor the protocol. Collecting and disseminating data is very important. So based on the previous data that we can use those data for further policy making. Resilience, plight of foreigners and laborers, social protection measures, vaccinations. That's what vaccinate. WHO was like called to these nations, and then generating database, then the public health surveillance. Just to sum up the second part of my presentation, inequalities before, during, and after COVID-19. There are two categories: higher income countries and lower and middle income countries. Higher income countries, the pre-existing inequalities and social structure, pre-existing social and economic inequalities, people who are well, Black, Asian, and minority ethnic, gender-based violence, increase in poor mental health. That was there even before COVID-19. But after COVID-19, even during COVID-19, there were additional issues, additional problems, or aggravated the existing problems, like people with less affluent neighborhoods affected more, lower socioeconomic groups, rural areas, Unemployed and the rural urban poor, lowest occupational class, child health, most deprived neighborhood, lower educational attainment, people with financial barriers, minority ethnic groups, marginalized groups including homeless, prisoners, street-based sex workers, and so on, from the higher income countries. The low and middle income countries, including India, the existing inequality include social and economic inequalities in the existing non-communicable diseases. Like the global burden of diseases by WHO can understand the division between the upper as well as the lower middle class. The pre-existing epidemic of chronic diseases, working conditions, including repetitive work, long hours, shift, low wages, job insecurities, and so on. Poor quality of housing and other infrastructural facilities, overcrowding, unequal health impacts. These were all the before COVID-19. Even it is still there in even during the COVID-19, but there are other additional problems. Most deprived areas, especially slums, rural areas, even the urban slums like Mumbai, Delhi, Bangalore. That's the second wave. We have seen that devastation. Most disadvantaged groups, because as I said in the beginning, single room house. Like one infection means multiple fold infections. Like the social determinants of tuberculosis or social determinants of other infectious diseases. The risk is much higher than this group than the other groups. Greater number of coexisting non-communicable diseases. Person with underlying risk factors like hypertension, diabetics, asthma, chronic obstructive pulmonary diseases, renal diseases, cancer, cardiovascular diseases, obesity, smoking, etc. Marginalized minority groups, working conditions of unemployment, and so on. Therefore, this has increased multifold inequalities in our system, in our country. The third part, that is the policy response, social networking and culture during the COVID-19 period, beyond COVID-19 and social development, future research and policy responses. What is needed here? To develop a workable strategies related to address the inequalities in the time of COVID-19 and beyond. Workable strategies means two levels, at individual level and state level. Individual level with self-discipline and the state level with the timely policy interventions. Social networking and culture during the critical period. Self-discipline, that's what I was talking about. Adjusting and accommodating personal lifestyles to cope with the diseases. There are established evidences to show the impact on these strategies. Our currently published another paper on Beyond COVID-19 Crisis and Global Health Diplomacy. As I said in even the earlier, like bilateral agencies, for example, World Bank, IMF, UN. So these are all the bilateral organizations. Multilateral organizations like USAID, European Union, DFID, and these are the organizations. They should come with the right kind of funding to support the emerging economies without any conditions, especially when they're dealing with the situations like the growing crisis. Growing inequalities in healthcare crisis. So beyond COVID-19 and social development, there are certain measures to identify innovative and culturally acceptable measures to prevent such kind of crisis beyond economic lockdowns. What we have seen, it is not about the COVID is going to kill people. People said on anecdotes, they said the economic lockdown is going to kill. That's what it said. Losing their employment means it's a big problem for them. To identify easily available, culturally adaptable local technology, which is easily accessible and affordable to everyone, ensuring that the most vulnerable populations are protected and consulted before government takes any decision. There was a lot of criticisms about the lockdown policies. What they said, government did not discuss this with the stakeholders, but evidence shows that if you're having a stakeholders consultations before they decide any policy decisions, then the results would be much better. For example, so the case of South Korea, the case of Germany, a case of New Zealand, they had a wonderful interventions based on the stakeholders consultation. Therefore, we could see the results. Organizing communities to ensure that the essentials, including alternative livelihood opportunities such as food, clean water, and essential healthcare and other services are available. Advocating priority-based social welfare services and in social policy environment that services adapt, remain open, and proactive in supporting communities, especially the local communities, minorities, and other vulnerable populations, particularly women, children, elders, and persons with special needs requirements, and their needs are fulfilled. Advocating for the advancement and strengthening of social welfare services as an essential protection against the disasters, including COVID-19. Identify adaptable or easily doable strategies, remain open and adapt to the conditions has largely been successful. For example, community participation in prevention and control, the ongoing and the future of social sciences research. Findings must support and facilitate the vision beyond this crisis and translate fear, sorrow, and loss into the empowerment and social stratifications by bringing the relevance of transdisciplinary and interdisciplinary approaches. So therefore, we must understand the interdependent and interconnectivity of scientific research, revisiting data sets, redefining relevance of methodologies, facilitate access to online sources, and explore culturally relevant approaches. Search for relevant information source and try to compile proper database and to deal with the crisis. To explore the COVID-19 impacts on social development, human happiness and well-being of helping professionals, their families and others in the community. Further, the synthesis evidences rapidly and proactively provide interventions guidelines. So what was missing in Indian context or the other developing countries context? Evidence-based interventions. Evidence-based interventions which will definitely bring a good results to promote inter or transdisciplinary research approaches through collaborations and networking. Ensure adequate quality of your work and communicate the same with the multi-stakeholders, including preparing policy briefs, humanitarian assistance and protections, impact assessment studies, efficacy and relevance of adaptable and flexible social assistance programs. According to the Kennedy School of Governance at Harvard, they also suggested few policy directions to deal with the growing crisis during the pandemic period. What they say is credible communications is needed at this juncture, drawing together, working together, mitigate the impact. We need global approaches to deal with the crisis, providing authoritative information, and then providing access to essential services, access to employment, access to income, access to assets, access to healthcare, access to education, access to formal employment, equal opportunities, social protections, and so on. It's needed at this juncture. Further, they said increasing transparency, recognize the potential for psychological burnout, vaccine therapeutic against the COVID-19, balance between protecting health and respect to human rights, new priorities, long-standing challenges of health and nutrition issues. That's what, we need to go beyond the biomedical perspectives, strengthen the food supply chains, and then to address the existing inequalities by way of strong political will. Therefore, in our next paper, this was published again on COVID-19, multi-stakeholder paper. Here also, we strongly advocated the above mentioned suggestions, mostly the participation of states by bringing the timely policies and programs. Similarly, the global governance responses. Global governance responses will have to advocate, they will have to follow the strict protocol, they will have to practice the signatory and the rules and regulations. So these 6 points I would like to conclude. The innovative, cost-effective healthcare services delivery models are needed at this juncture to deal with the current crisis, particularly the growing inequalities. Implementation of government schemes in efficient, transparent, and accountable manner, like long-term public policy responses. Economic activity should be resumed, and supply chain resource and improve. Special attention should be paid for protecting the income of livelihood and food security. This again, it's about the deprived sections. To increase budgetary allocations for social services and relief background, measures to develop sustainable societies, political will to promote inclusive economy and society. There was a very disturbing picture on the growing inequalities. Only that the state can take an active role, especially in the low-income countries. Let me conclude my presentations by highlighting a quote by Mahatma Gandhi. Potential public health disasters, collective actions to address the global health issues, including inequalities. Let's look at the quote by him. I think there is an answer here in this quote. The earth, the air, and the land and the water are not an inheritance from our forefathers, but on loan from our children. So we have to hand over to them at least as it was handed over to us. With that, let me end my sessions by highlighting that the self-discipline is more important than anything else. So stay safe. Thank you. Thank you for the wonderful opportunity.
Thank you, sir.
Thank you. Thank you, Professor. It's a wonderful lecture and rich content. And every line for this whole lecture is Mani, please.
Yes, sir. Yes, sir.
Thank
you. Thank you, sir, for your informative and statistics. It is a very useful speech for us, sir. Now for open discussion, do you have any discussion or any argumental factor with our today's chief guest? Now, we are ready to accept your discussions. Now, please raise the questions or unmute your questions. Ask the chief guest. If you watching the program through YouTube, now just you ask the post your questions through chat box. Thank you.
Maybe you can post these questions on the chat box.
Yes, sir. Yes, sir.
Yeah. I know I was running through those slides. So a lot of information due to time constraint. I could not explain each and everything. But the point here is that the understanding the causes and consequences on human health, a case of growing inequalities and social relationships. And once after completion of this write-up, publications, I'm going to share this paper with the team. You can send it to everyone for attending this workshop.
Okay, sir. Dear student friends and participants, do you have any questions and suggestions or queries you want to discuss with today's chief guest? Please unmute yourself and ask a question to him.
Hello.
Yes, sir. Yes, sir. Very good afternoon. Good evening, sir. Dr. Saranadurai, sir.
Yeah, can I ask some question to the resource person?
Yes, sir.
Good evening,
Please.
sir.
Good evening, sir.
Yeah, nice. It was a good talk which I heard it. And I want some kind of clarification is that I also read in some of the papers which has been published in contest with to the Indian scenario. It says that due to this COVID and lockdown, even cities like Delhi, the carbon emissions have been reduced to some extent. So how can you say the inequalities is widening? Not only in Delhi, even in big cities all globally. This was one thing which I read. This one question. And another one, in your entire speech, you were telling things that it has been drastically changed. It has been significantly changed. The income inequality. And I just want to know what is the numerical evidence of that, how much the quantum of change has taken place. Maybe the income inequality or the per capita consumption, whatever it is. But the another paper also, which I read, says that something that the per capita consumption also has increased during COVID period. So there's something contradictory. So I don't want to clarify it from you.
That's great. That's great, Dr. Saran. And 3 questions, excellent questions. So let me share my experience on those 3 questions. Number 1. So the environmental implications, of course, in terms of the air pollution across the globe, there are positive information. It has improved. But actually cases like the natural disasters, for example, the southern part of this country, flood, cyclone, and even other parts of the world, wherever there was a natural disasters, it actually added, the multifold, problems in the prevailing situation in terms of infection, in terms of providing the relief work, in terms of providing support system. That was the point I was trying to create. I was trying to support. So, of course, the COVID-19 has exposed certain positive aspects as well as the negative aspects in terms of environment. Cities like Bangalore, New Delhi, the air quality index has drastically improved. Air quality index during that period due to the lockdown. That was there already. But I'm talking about more on the natural disasters in terms of environment, climate change. It has actually added to the prevailing condition. That's number one. Number two, about the drastic decline of the per capita income. So there are studies. There are not actually exactly the original research papers, the reports published by the World Bank, IMF, and UN. What they say is like people have lost employment due to the lockdown measures, and people have lost their employment. People are not getting employment during that period. Now, slowly, the many economies are recovering from such kind of situations. But the overall, by the data by the World Bank, they says 150 million people may fall into chronic poverty. Exact data they gave. And then even 2023, 24, and 25, this is the period, the required period. People might get better off. But the situation is not exactly the way the many states were thinking. But globally, especially the low-income countries, the poverty and unemployment rate has increased. Even those papers published in Economic and Political Weekly, you can understand. The third, it's about the per capita consumption. Of course, the COVID-19 added a much more positive sides to the e-commerce, e-business, and e-business. Okay, so these are all my comments. Okay, I hope I have answered Dr. Savanan's question.
Thank you a lot.
But still, thank you so much. We need to read more literatures on those three aspects. Yes.
Yes. Thank you.
Thank you.
Sir, one more question we received from D. Saktivel. He asked, who create inequalities, politicians or MNCs? Would you think inequalities are removed?
Wow, that's great. These are questions we read much more long, much more debates on this. Who created inequalities? Is that politicians or multinational companies? This is a debatable questions. What I understood, the inequalities was inbuilt in our system already, even before the politicians were existed. It was there in our system itself. For example, caste, class, and culture in Indian context, and UK context, economic divisions. In American context, again the racism that was there even much more before the MNCs and then the politicians thing. So there was a structurally rooted inequalities were there. So how we can deal with the crisis at individual level? We'll have to take individual steps to deal with such kind of inequality. I hope I have answered this question.
Yes, sir. I hope also like the same. One more. Yes, sir. You can proceed now.
Yes, sir. It's all about the political economy of health. It's like, egg, whether chicken from the egg or egg from the chicken. The inequalities, the debate on inequalities, this actually required a lot of debates. But the available literature says inequalities were even before by way of caste, class, culture, and so on.
Yes, sir. Sir, one more person raised their hands. Gunasilan Srinivasan, just you unmute yourself and ask the question to Chief Guest.
Yes, sir. Sir, I'm Gunasilan from Coimbatore. I have a question that before to me, Sir spoke about the technology, environment, etc. So even the technology in this time has increased more. That means to everyone's hand, the touchscreen phone came because the need of touch phones for entertainment as well as for the education. If we see with that means the technology is going to everyone's hand, as well as the technology, the growth of technology is speeding up. So there is a cliche called whenever the technology grows, the nature destroys. As well as what do you see or what do you analyze during this COVID period that is related with environment and technology? That one I need to know, sir, from you.
Wow, that's again another great question by Dr. Guna. So this is a time we must realize two things. Number one, The environment, importance of environment and the relationships. So people have realized that, that kind of belongingness, living for others, respecting families, respecting friends, and so on. Same time, the importance of the environment. So as we see, like the technology grows and grows, there are certain implications, but of course the benefit is there. The COVID-19 has exposed a lot of things on positive side as well as the negative side. The positive side, it's like we need to have an alternative system to deal with the crisis, including the access to technology, number one. Number two, the COVID-19 in a positive side exposed us that, even without those essential facilities, we can live. For example, regular visit to those shopping malls, buying expensive items. Last 2 years, even without those things, we can lead our life. Then the negative side of it, that's what we have already discussed several aspects. So what we need to know, we need to now contextualize those with the positive side of it and expand that system. For instance, the mobile phone usages among the school children by way of promoting the online teaching. We have seen several occasions, many kids in the south part of our country, even the other side of our country, committed suicide due to non-availability of telephone, non-availability of smartphone to attend the online classes. Many parents, there are updates published in Economic and Political Weekly. Parents, they have sold their properties, or they've sold two-wheeler and then some of their household consumption items to buy phone for their kids.
Yes, sir.
Therefore, two things are actually happening simultaneously: positive side and negative side of it. But it's the time we need to contextualize. We need to bring, friendly, user friendly, or even people should have that kind of access to those essential facilities. Okay.
By thinking that the individual saving is lost in this COVID period too.
Yes, agreed. Completely agreed. They have used those individual savings to buy the essential commodities.
Sir, that means economically it's already it's creating inequality, but in education, how it is creating inequality? All of them having, the people who have smartphone is something different, and that and all, sir. But the receiving of education is, I feel that there is inequality. I mean, through smartphone, also whoever receives education, they also have the inequality. Whether do you agree with that or not?
Yes, I completely agree with that. It's a kind of growing inequalities. You look at the opportunity cost investment on their education. It is not just about only attending the classes. It's all about, for example, the primary school kids. You gave a good opportunities. That doesn't mean that they should only attend the online sessions. There's something much more beyond, like the opportunity cost investment on their education, interaction, understanding, sharing, playing, and so on. It's a multifolded implications on education.
Yes, sir. Thank you, sir. That was
Thank you, Dr. Gurna.
and,
Sir, we have received two more questions. First one is Dr. Vikrant Mudaliar. He asked coronavirus. Sir, can you hear me, sir?
Coronavirus disease 2019.
Yes, no, sir. No, sir. Coronavirus has
No, no,
brought, Dr. Vikrant Mudaliar asked, coronavirus has brought to wider consciousness inequalities in areas from healthcare to technology, sir. Your comment on this?
Yes, exactly. It has brought such kind of inequalities. It actually broadened that inequality. Like we have seen there, the marginalized section, deprived sections, vulnerable sections. For them, it's a dual burden on their health. For them, it is dual burden on their livelihood. Those who lost employment, they can understand its implications on their day-to-day life. Therefore, there's a multifold implications. We are not talking about the 1% of the total population. Those who have money, there is no problem at all. It's all about the majority. It's all about the general population. It's all about the major findings. The major findings, it has actually widened that inequality.
Yes, sir. One more question from Mujibul Amin from Central University from Kashmir. She asked, as he's also one of the student, hello, sir. Hope you are fine. I am from the Central University of Kashmir as a student. Is more saving is dangerous for the economy during the COVID-19 pandemic?
Oh, great. Good, thank you. But where is the money to save? But only one set of populations are saving money, but not others, 99%. So somebody said, they're saving, the whole saving got spent. People are they're saving. In fact, people sold their properties to buy certain essential things. Like in Delhi, what we have seen, people spent lakhs together to buy oxygen cylinders. People spend a lot of money on buying essential equipment, essential support system for those COVID patients, isn't it? But where is the money to save? Maybe one set of group, not for all. That's what the evidence shows.
Okay, sir. Thank you. One more question from YouTube viewer. What is your opinion on self-help groups? Could not we reduce inequality through SSGs?
Great. See, the purpose of establishing self-help groups to promote women empowerment in our country, I hope. That was the initial plan. But now that has moved from the empowerment to being independent, and then establishing themselves on certain aspects. So now the critical point here is that it's not about only economic independence, it's about freedom from several other aspects, like right to choose their employment, right to send their kids to the schools, right to get the access to those essential facilities, and so on. But due to COVID-19, there were certain containment measures, but now the state governments, even the central government, had come out with certain policy interventions to support this group, self-help groups, to promote again the women empowerment through strategic decisions. Okay. Again, microfinance and other support systems.
Thank you, sir. One more question from Gunasel and Srinivasan. Social psychology changes in COVID period, positive or negative, whether that will enrich society or losing the strength?
It's a very good question. It's again a debatable question. So in my opinion, social psychology changes, in COVID period, actually they're the more negative side than the positive side. For example, school kids. Okay, so every house we could see that the kids' interactions with the elders, kids' interactions with the family members has drastically, like changed. So that's what one example. And then isolation, suicides during this period, and then human happiness drastically reduced. Human happiness in the sense, like increasing rate of the communicable diseases like diabetics, cardiovascular diseases, hypertension, and so on. So, what I think here, there are certain problems due to this, but obviously we need to bring the timely interventions by bringing the qualified and technical personnel to deal with such kind of crisis. For example, supporting children through counseling and employment opportunities to college going graduates, and so on. Therefore, the positive psychology, social psychology relevance, it's still most needed.
Okay, sir. Thank you. Dear participants or students, do you have any questions?
Sir, finally, can I ask him something?
Sure, sir. Welcome, sir.
Sir, as a social worker, professor, can you just suggest any policy for the current situation?
That's great. So we have already worked on, sir, 3 major research papers. One was on multi-stakeholders participation in COVID-19, where we brought up a document by bringing individual level, family level, community level system to deal with the current crisis. That was one policy. The second paper was on the global lockdown and its impacts on human health. There we have brought up the policy documents on the relevance of global health diplomacy, both bilateral and multilateral agencies. And then the third one So working with individual level, family level and community level, it's a time that we should include subsections in our intervention strategies, like the social work methods, so that our young graduates can understand the case studies, and then based on the problems, they can develop the right kind of interventions at various levels, like individual level, group level, community level, policy levels, and so on. Okay. Saravanan sir, I hope I answered your question.
Yeah. Has this reached the think tanks of the bureaucrats?
The publications was done already, and then we are working on the exact policy documents. We will be completing it in few months' time, 2 months' time.
Thank you.
The preliminary document has reached already. We are getting good feedback.
Thank you, sir.
In fact, Dr. Saravanan sir, 2 of our paper has been listed in the WHO policy note. Policy note.
So it is available online. We can view it.
Priority documents.
Okay.
It as a priority document.
Great.
Thank you.
Thank you. Those were the wonderful questions, Dr. Saravanan.
Okay, thank you, sir. Anybody have questions now? Sir, Mani sir?
Observation, rather than questions, our senior faculties are here. If they are having some observation, they can also pass their observations.
Exactly. They can also share their views,
Rather than question.
their ideas, their suggestions.
Yeah. Otherwise, we shall wind up.
Dear students from Erode Arts and Science College, do you have any questions? So far, no one is asked the questions to today's chief guest.
Dr. Vikrant raised his hand. Dr. Vikrant, could you please unmute your...
No, his question has been already read out. He is from Goa.
Okay.
His question read by Dr.
Hello?
Mani sir, your audio is not clear.
Yes, sir. I think Mani sir signal is very weak.
Yeah.
Okay, sir. We can come to conclude, sir. Okay, sir. Thank you so much, sir, for your informative. Once again, I express my sincere thanks to your informative sessions. This is a time for delivering a vote of thanks. First of all, I wholeheartedly thanks to Dr. SIGAMANI P, sir, who has delivered a valuable lecture on this August forum. I wholeheartedly thanks our principal, sir, and the director, sir, for their valuable present and valuable presidential and felicitation address. And I also thanks our HOD for delivering welcome address and the introduction of today's chief guest. Sir, thank you, sir. And I thank Dr. Pari, sir, senior faculty member, senior faculty and senior professor of our department, and my dear colleagues, Dr. Maliha ma'am, Dr. Ilangovan sir, Dr. Babu sir, Dr. Revati madam, Dr. Saravana Kumar sir, Dr. Aljodi madam, Dr. Kasturi madam. Thank you for your kind cooperation. And I thank all faculty members from outside the colleges all over the India, especially Dr. Saravana sir, Associate Professor, Department of Economics, Periyar University, Dr. Rajeshwari madam, and Dr. M. Neela Devi madam, Dr. Chidambaranathan sir, and Sarojini Topne from Madhya Pradesh, Dr. Santosh Keskar from Maharashtra, and Dr. Perisamy sir from Nagaland. Once again, I thank you, sir. In particularly, especially Deputy Superintendent of Police Training, R. Sindhu, Kanyakumari District, and Dr. Kumar sir, Associate Professor, Department of Economics, Jamal Muhammad College, Trichy. Sir, once again, I thank you, sir. Finally, I thank our students for their participations. And once again, I thank the head of the Department of Economics and the principal, sir, given me the opportunity to organize this kind of a webinar series. Thank you, sir. Thank you so much. Sir, one more questions from Babu. Sir, One more questions from Babu.
Yes. This is also from student.
Yes, he's our student, sir.
A student friend has raised.
Yes, sir. Babu, unmute your question, unmute yourself and ask the questions to him.
Good morning, sir. I'm Babu from Erode.
Babu, you can type your question in the chat box.
Hello, sir.
Please type.
Okay, Babu. Okay.
Your voice is not audible. You can type. Chat box la type பண்ணுங்க. Dr. Mani?
Yes, sir.
Yes,
That is there.
yes, Professor. Yes, Professor. I think Bob speak and is able to. I think shall pass on whenever the time is permissible. Thank you, Professor. I think we shall wind up this session. Thank you.
Okay.
Thank you so much, sir. Thank you, sir.
Thank you, Professor.
Thank you, everyone.
Joyful.
Thank you to all
Rich session.
participants. Thank you, sir.
Happy weekends. Thank
Thank you so much,
for
sir.
the wonderful opportunity.
Happy. Thank you. Thank you. Thank you so much.
Thank you, sir.
Thank you.
Thanks.